So
Okay.
we're talking about exercise today, and you just brought up that every time it's kind of discussed in social media, you said these glittering generalities.
Yeah.
It's a
So
lovely term.
I feel like even on social media, it's one kind of beast. But then even on like podcasts where they talk about it, I think there are episodes that have covered this well. But I find it fascinating when psychiatrists talk about the studies around exercise and mental health and the bidirectionality of it. And also just, I think it can be really empowering if we can help people get back to movement that they love. But like getting specific, I don't see a lot of. It's like, yeah, exercise is good.
I think that's one thing that frustrates me too a little bit is that if you asked a room of 10 psychiatrists if exercise is good for mental health, they would probably 9 out of 10 would say yes, or all would say yes. But then if you ask them how many have like built workout plans with their patients or have like discussed exercise with their patients, it's like 0.
Yeah.
And like the amount of times that a patient will say like, I started exercising. And then the doctor is like, that's great. So good for your mental health. But then they'll never go in with, hey, have you thought about starting to exercise or even that there's a connection between exercise and your mental health.
Right. Which I think makes it hard for people to be motivated by if there's, and it's, I like you and I both understand the healthcare system, who has the time to do this, And I know that, primary care, pediatricians, psychiatrists, anyone interacting with mental health has limited time. But I also think you can do a lot by bringing it up even just for a couple minutes at the end of the visit and getting specific. So that's what we're hopefully going to do.
Saying, hey, did you know that like science shows there's a connection between working out and depression?
Yeah.
Because I think most people don't even make that connection. So they don't even know to start there. Like, oh, I thought it was just a means of like getting rid of fat. Like who would have thought this could have helped my mood? And I think on top of that, we learned a lot about diagnosing mental health and prescribing medications for psychiatric illness, but I don't think I learned anything in medical school about fitness besides it's good for you. And actually everything I know about fitness has come from my tenure as an athlete and everything I do in personal training, but none of that was like from my medical education.
Well, I think that's actually the question we should start with. As you know, I think it's always important to start with our bias and background, both because it's helpful and because if it's going to be hurtful, we can kind of mark that ahead of time because we're going to be talking about exercise. And I think this can be an unexplored topic, but also a difficult topic for some people, depending on their own history with it and their history with body image or experiences around ability or disability. So I just want to mark that at the beginning that we're going to be talking about exercise, hopefully in a nuanced way. But I want to start.
Margaret, I don't use nuance.
Right. Preston doesn't know how to. Just kidding. But I think starting with our own backgrounds with exercise for the first few minutes before we go into some studies around exercise and mental health, and then mental health's impact on people's ability to move and exercise. And then we'll end today with kind of our thoughts on how we might talk about this in clinic or with friends or whatever. So, Preston, do you want to tell me about your life or with enemies as an athlete?
I'll start telling you about my life and exercise. My first relationship with exercise was when my mom said, you have to go outside or I'll kill you.
She did not say I'll kill you.
No, she didn't say I'll kill you, but she was like, when I was your age, I was running around the cornfields and all this stuff. So like, I think I was just pretty conditioned to be like running around barefoot in my backyard, finding shenanigans to do, climbing trees.
Stepping on rusty nails.
Exactly. Yeah. We had a Macintosh tree in my backyard that I would just climb to the top of and jump off of at sequentially higher heights.
Is that real?
Each time. No, it was actually my trampoline that I did off of, not the Macintosh tree.
Okay.
But it kind of flows better in the story.
I can't read this.
Yeah, so it was good. I learned how to roll out of a landing, it's called a parachute landing fall. Actually, learned that in the Air Force. But the point is, I saw exercise at this time in my life as almost like a prescription from my mom to stop being like a lethargic kid, and then it turned into an outlet when I was pretty young. So my mom said that we had to do an individual sport and a team sport, and my individual sport was track, and my team sport was soccer. I was good enough at track that I ended up running all through high school and actually got invited to play Division I or to run Division I in college. So I kind of went from being this person that saw exercise as something just fun and being outside to almost like a part of my life. It was a job essentially in college.
And what was your event?
I was the 800 meter.
Oh.
So the 800 is really just a test of like resilience, or I think for me it was self-hatred.
Girl.
Well, because if you have a lot of,
I believe you. I did track not well, but I believe you on that.
Self-compassion. Nobody wants to run that second lap. So every part of you is like, I should give up. And then my inner monologue is like, do you want to be a loser your entire life, or are you going to finish this race? And that was
And
actually
that's why I
how,
went into med school.
yeah. So anyways, really stable sense of self. Definitely don't have any idea why I went into psychiatry. But I saw like track honestly as an obligation, but it was also a source of community for me. A lot of my friends are on my track team. Actually, last weekend went to a music festival with like one of my former teammates who I guess we've known for like 7 years now. We met on our recruiting visit. So our like athletic skill or like our athletic um pursuits were the foundation of our relationship for almost a decade now. So I think I've had a complicated relationship with sports because I also resented it a lot in college. They would do DEXA scans of us, like track our body fat percentage. I remember kids would get bullied on the team if you gained body fat.
Wow. Wow.
And I remember like being scrutinized over what I was eating, things that were like seen as unhealthy. So there were like points where I remember like intentionally losing weight just because I like was unhappy with how I looked and felt like it would affect my performance. I became iron deficient at one point because I was kind of starving
Wow.
myself. So I guess in summary, exercise has been a positive outlet for me. It's been a source of community, and it's also
Hmm.
been almost like a aspect of disorder in my
Yeah.
life.
Yeah.
And
Yeah.
it kind of hangs out with all of those at
Which
once.
I think is relatable to a lot of people, maybe with, different details, but that this both like positive parts of movement, of play, of empowerment, of strength, of bonding with others, as well as these negative parts, again, maybe with different details of like body image, control of image, how much pain tolerance is the right amount, and then like avoiding it or not knowing how to reintegrate it in a healthy way.
Mhm.
Um,
So, Margaret, I'm curious, what is your relationship with exercise?
so I feel like I am the youngest of four, and I was raised with a sister and two brothers. And I say that because I think it made my childhood and my view of both food and exercise a little bit different. Like my brothers were like 4 and 8 years older than me. So they were always eating a ton. They were always in sports. My sister was in a ton of sports. I was like the creative one. So I was
Mhm.
definitively not good at any sports, but I still played them because I was in a small town where if you wanted to be on a team, you could be on a team.
Mhm.
So I played volleyball badly and did cheerleading mostly because I wanted to take dance classes, but they didn't like have anything besides that. Like there was no dance team. And then I have I have memories in high school. I would say the most disordered with like exercise I ever got was me and my friend would like exercise more before like homecoming or prom. And Kim Kardashian had this series of DVDs that with her trainer that were like honestly actually like I'm sure the language in them now is like horrible body based wise, but they were like actually decent. Like they were the first times I like picked up like I think like a dumbbell. And I'm sure my dad saw that. My dad had tried to like with volleyball be like, here's some strength training you can do in the off season. And I was like, no, I need to do Kim
But
Kardashian's
yeah, Kim
workout.
Kardashian, she was the true conduit to strength training.
Yeah, but then I did cross country in high school and I really liked that. Again, I wasn't very fast, but it was like easy. Like my family, like my parents both run marathons. My sister's like pretty fast and runs a lot. And then my brother like does CrossFit. And so I feel like as in college and then med school and now in residency, I've had a different like an expanded relationship with movement of like what do I actually like to do? Is it running? It's not really running right now for me, but like similar elements of like dance and then also being like, oh, I need to build some muscle like for overall mental, physical health as well as just like I don't want to have weak bone. I'm like likely to have osteoporosis, but I'm like let's try and fight that off
Yeah.
for as long as we can.
So in part, it's self-expression and also kind of a means to preventative health
Yeah, I think so at this point for me. Doesn't
or
mean I
improving
don't
your
ever have
overall
like
picture of health.
body image days or those concerns. Those are definitely there, but I think I've been lucky in that they've never been super loud for me at any point in
Okay.
my life.
So overall, you're happy with how you look.
I mean, I think it's less that and it's more like maybe body acceptance would be a good kind
Mhm.
of
Like you don't
view of it.
see exercise as a means to changing the appearance of your body rather than kind of improving its overall health.
Right. And I think a lot of the exercise I do, I like it in and of it's like it's intrinsically motivating to me versus like the end goal of I need to be able to run this fast, which is I think a way I used to identify more within cross country, or I need to look a certain way. which certainly as like a woman, there are glimpses of that always. But I also purposely don't put myself in spaces now as an adult of like exercise classes where they're like, we're going to lengthen and tone. First, because scientifically it bothers me. But second, because it's like, girl, let me just enjoy a workout without you like
without you equating this to my
in the room.
sexual appeal. Yeah.
Yeah, exactly.
I felt that. I've gone to like a spin class and been like, okay, I have a feeling my partner will love me regardless. Why are we talking like this?
Why are you talking about my thighs like that right now? I like my thighs. They're doing a good job.
So can we take a moment to, I feel like, because I have some passion about this too. Why is toning not a thing?
Okay, so toning is a word I think made up by the fitness industry. And there are people who have talked about this better online. Specifically, shout out to one of my TikTok mutuals, but they have the podcast Fit Literate, which goes into the history of some of these things. But toning is like this word that's only used in like female spaces historically in fitness. That's basically is trying to connotate like getting skinnier while having some muscle tone and not making people afraid of being like bulky. And so tone is just like that. It's not real. It's not a thing that exists. There's losing fat to reveal muscle. And then there's increasing muscle size. So it's more visible underneath fat, alongside fat, Tone so
there's only two volumes there that exist, right? There's muscle volume and fat volume. So you can either increase muscle and increase fat or decrease muscle and decrease fat or any combination. So I think when people say toning, they mean spot reduction of fat.
Which is...
So we don't need to go into the science of this, but if you have fat that you want to reduce on your triceps, doing tricep extensions will not spot reduce that fat.
Right.
Which is why Margaret and I are unapologetic haters of the term toning.
Yeah. And I think, again, toning is such an aesthetic specific word for women of like make it look this way. It's nothing about function. It's nothing about strength. It's nothing even about ability. And so whenever someone starts using one of those words in a workout class, my like estimation of them goes down pretty quickly. I feel like we have 1,000 opinions on this. So why don't we start off with what we are here to talk about?
So now we've kind of gone through our relationship as athletes or self-expressionists with our relationship with exercise.
Yeah.
Let's talk about why psychiatrists should care about exercise. So we'll take a little bit of a break, and when we come back, we'll get into why it matters in the clinic. So, Margaret, I have a confession to make. I'm a psychiatrist and I care about exercise.
I don't actually, so the episode's over.
Okay, so anyways, moving on. Let me convince you why this matters.
Okay.
Talking point number 1. Exercise impacts. I can read off the run of show if I want to.
We have notes, you guys.
So the first postulate is that are exercise and mental health related? And I think that ultimately most people agree irrefutably yes.
Yes. Yeah. And I think it's one of the things that you and I have talked about and maybe think about is the bidirectional way that they're related, i.e. exercise and movement and mental health or mental
explain
health
that a little bit, that bidirectional relationship.
Yeah. I mean, I think the one that we'll talk about more in depth for the rest of this episode is the way that exercise might help with mental health. But I think also as psychiatrists and clinicians, one of the things that we know or that is less talked about is how that there is a difference or change in energy, fatigue levels, and like overall somewhat body movement in different mental health conditions when they're worse. I'm thinking specifically of depression, but you could also think of anxiety disorders in terms of like restlessness, pacing, shaking legs, and none of those, right? We're talking about exercise, but I think if we zoom outside of the term exercise and ask about movement and energy management overall, which is I think intrinsically what exercise is also about, there are many aspects of mental illness that can change someone's ability to move or their drive to move that I find interesting, and I think is also something we have to think about if we are wanting to help our patients to find exercise that works to help them.
Yeah. So when you're talking about the bidirectional relationship, you're describing exercise both as a treatment to mental illness and then mental illness as a barrier to exercise. And I think there's almost a third aspect there, which is lack of exercise as a risk factor for developing mental illness. Yeah. And so we know there's a pretty strong relationship between obesity and depression. And that's kind of one of those that also sits with the chicken or the egg phenomenon. It's unclear if there's some kind of metabolic changes based on like a chronic inflammatory state that predisposes someone to depression when they're obese, or does the avolition and lack of movement when someone's depressed contribute to their weight gain,
Right.
or
something
literally
else.
change their metabolic function. Yeah.
Yeah.
So let's talk more about how this kind of breaks down in depression. And just for anyone who's not familiar with psychiatry, what are the kind of classic symptoms of depression we see as they relate to exercise?
So I think that, whenever we're med students and ask about, there's this mnemonic SIGI CAPS that is the common depressive symptoms. So it's like low mood or sadness, lack of interest or anhedonia is the fancy word we use, guilt or sense of worthlessness, and then energy, usually lower, but there can be irritability sometimes depending on who it is in depression that can look sort of like an energy dysregulation. And then concentration, appetite, psychomotor, which we'll get back to, and sleep, and then suicidality as well. And then the psychomotor part, when we think of like a classic depression, we think of something called, as Preston, maybe you want to talk more about this sort of neurovegetative state or the psychomotor slowing.
Yes. So I don't fully understand how the like psychomotor slowing happens, but you could almost observe like a bradykinesia, especially in geriatric patients, similar to Parkinson's, where I'll ask patients, like, so a good test for bradykinesia is you just have them tap as fast as they can, open, close their hands as fast as they can, and you'll see like pretty marked differences. And so they'll almost like kind of, it's just like they're moving through molasses. And another thing that's really interesting to me is that in addition to having this inability to move their body with the same thrust that they had before, they also like have trouble paying attention to their environment and kind of viewing things around them. And so I think a lot of that has to do with suppression of, we know it affects dopamine pathways in the, I would say like the anterior and posterior cingulate cortex. And it has something to do with like postsynaptic expression of 5-HT2A receptors. It's about all I'll say because we don't really know what else from that.
Right.
We know that, hey, when someone died and they had depression, they have more expression of these 5-HT2A receptors, and we prescribe medicines that block them and they treat depression. So maybe it has something to do with that, but it could all just be a red herring and have something to do with something else.
And then to take that, so there's like the neurobiologic aspects of that you were explaining. And then from the kind of psychological aspect, which these things are not actually separate, again, different lenses, just look at sort of these different phenomenon. But there's the slowing and the like the physical sense of that, but there's also like, as you might imagine, as any of us can imagine, or people in healthcare, if you've been working a week of nights in
well, I kind of opinion about that.
Brought to weighing in, she's like, I love movement. But the different parts of depression, right? So the decrease in energy and in the increase of fatigue, the lack or increase, like the dysregulation of appetite, also the sense of guilt and worthlessness and then not enjoying things. As you can imagine, all of those things are probably going to interact with your ability to go for a run or enjoy going to the gym.
All behavior is driven by, like, if you break it down, it's driven by seeking out a positive feeling or running from an unpleasant feeling. So if you can't feel pleasure anymore, the positive feeling you get is like that incentive is decreased.
Right.
So you have less of a drive to go work out.
Right.
And if you feel guilty all the time and you feel hopeless, then maybe you don't have any optimism that this action will extinguish the negative feeling. So now there's no reason to. Whereas,
and to put a body image lens also on this, that if you're someone who has dealt with like fat phobia or other things to make you dislike your body, exercise in and of itself can be complicated. And if you're depressed, and those feelings can be stronger when you're depressed or more anxious because they happen at the same time. Understandably, being more present to your body too then is going to be harder.
Yeah. And I think one thing that people don't acknowledge about guilt when we think about how it affects our illness is this feeling that people deserve the station that they're in. So the idea that I deserve to look this way is almost a direct extension or manifestation of guilt, which is going to be a barrier to someone wanting to change how they are.
Right.
I think, and just in general, this is a hot take that I think we can kind of ask about guilt pretty generally. Like, do you feel guilty all the time? And I think a lot of people say no to that, but then you ask them if like they deserve what's happened to them, or if like they think that things should get better. They're like, no, it's my fault. The family, everything happened, and they don't see themselves as like the villain, but they feel it that they're not worthy of a better existence, which is a manifestation of guilt.
The self-criticism is super strong. And that, especially if you're struggling with anxiety and depression at the same time, having that kind of running critical voice, it makes, I think, can really impact whether movement has a possibility of even being possible or feeling good. So there's all of these parts that we're talking about of depression and anxiety, which we're talking about because depression has the highest kind of, and we'll cite this in the resources, but depression, I think at this point, at least this was maybe as of 2020, so it could be different now, but has the second highest rate of kind of years lost disability, kind of illness years, at least in the United States and broadly, I think worldwide. And then anxiety is the most prevalent in the United States.
I think it's like an estimated 1 in 4 have some sort of anxiety traits or symptoms. And I think we have like 15 to 20% diagnosed, and we estimate that more undiagnosed.
Right.
And I think I just took PRITE, the in-training exam last week.
Nice.
Yeah. And I think that actually came up too. Depression being like the largest source of disability adjusted life years. So it's regardless, it's a significant burden. And I think when people identify obesity as an epidemic in the US, they kind of forget that like underscoring all of that is the ability to fight obesity, or to the things that may be tied very closely to it, which is mental illness.
Right. I mean, and the reasoning for that mental illness, I want to clarify, we do not necessarily know. I also just want to state that there's a lot of fat phobia and bias in the world that may also be a kind of variable that impacts mental health given like existing in a larger body. So just want to earmark that as well, because this is a complicated topic.
Thank you for the nuance.
You're welcome. But I think what might be helpful for us to talk about with depression now is to kind of move into the second part of like, how can exercise help? Let's stick with depression, then we can touch on anxiety a little bit too. But I think depression is a really hard, I think it comes up a lot that like exercise is good for depression clinically, but then depression also, for all the reasons we've just said, can make access to exercise super, super hard. And so I think talking about this, a lot of this applies to other mental health concerns too, as well as like schizophrenia and bipolar. But obviously there's different considerations, but in general, I think a general thing we could say is exercise is probably good for the brain. How much, which kind, and to what intensity we will talk about is a little bit more not yet clear.
Yeah. So I think 30,000 foot view, we know that when you exercise aerobically, you release brain-derived neurotropic factor. And we know that other factors like that, or similar ones, have direct effects on neuroplasticity. So they can affect our expression of acetylcholine receptors in the hippocampus, and they can modulate how we affect our mood. That's about it. That's like, I can't go into any more detail as to like the specifics, but if all you need to know neurobiologically about exercise is like, if I exercise, I'll release BDNF.
Yeah.
And that's going to have a lot of positive effects on my brain.
Right.
Like another thing that can affect it, our BDNF, is something like ketamine, which we actually see almost like overnight differences in people's affect or their depressive symptoms. But outside the kind of vague biologic.
Wait. Before we move from the biologic, I do want to say that there's this book that I highly recommend that's The Joy of Movement by, I think, Kelly McDonald. Hold on. And it's a book that goes through different parts of why exercise helps people. And it's like kind of an social study as well as some of the neuroscience around why like different exercise helps people, both sociologically, anthropologically. Kelly McGonigal, PhD, The Joy of Movement. But
what a strong name, Kelly McGonigal.
I know, great researcher name. But in the book, they various parts of it go into different communities, but they also talk about the neurobiology, which again, there's a lot that we don't really fully concretely know yet, but just the profile of exercise across kind of neurotransmission and neurohormonal like components is fascinating and varied. And I kind of nerd out on that. And I think Preston, you do too. But I just want to say that I'm excited to see where the science goes on that.
I'll have to read that, The Joy Movement.
Yeah, it's a great book.
McGonigal, PhD. Okay.
But you were saying moving beyond the neurobiology, I just wanted to flag that.
Yeah, so now we have like a whole psychological aspect of why exercise is helpful. And when you get down to brass tacks, I think about depression a lot of times as someone's loss of purpose and loss of structure and loss of belonging. Those are all intertwined in depression, and one of them can be the primary driver if from a psychological lens. So weirdly enough, a workout class is a great antidote to a lot of those things. Like people build a lot of community around their workout classes. So I was an F45 trainer for a while. And
that's a fun fact unlocked.
Yeah, shout out to Kira at 45 Chapel Hill. If she ever sees this, Kira is so good at creating a sense of community.
Oh, that's awesome.
Like her whole thing around the program, and she writes everyone's name down. She's so socially inclined. Like I remember I went just as a guest the first couple times, and she remembered my name weeks later when I showed up. She's like, "Oh, Preston, how's it going? Like, I know you were a track athlete. How are things?" I was like, "Oh my gosh, thank you."
Yeah.
And she gets gifts for people when they come to their 100th class. She makes little gift baskets for them. She always makes sure to take their picture and like include them in the Instagram. And then they host like movie events and other things outside of fitness for this group. So community is really big for them. And so someone who's struggling with their belonging, rather than exercise in and of itself neurobiologically, but it's a vehicle for them to find people with similar interests.
I think another one that related to group exercise, or I think obviously it can be done individually, or with things like personal training or taking classes that are maybe group fitness, but also things like martial arts or climbing or dance classes where you like build a sense of a skill that you enjoy. So the sense of like mastery in one arena can kind of lateralize to other parts of your life, or kind of increase the sense of like an internal locus of control in a small way. And I think exercise communities can be a really big place. Like that is also very helpful in terms of the meaning and things that you were talking about, as well as like positive structure, like wanting to progress in something.
Yeah, and in addition to the desire to progress being a form of structure, there's a schedule around it.
Yes. Yeah.
I want to show up on Saturday because I'm going to see people. So one thing I've been doing recently is like a run club every Saturday.
Oh, fun.
And so I have friends that I know. Our main form of like interaction is at run club on Saturday because we're both on busy rotations. Everyone's kind of stuck, but I know like Teresa needs to get a run in the morning and I do too. So I'll text her on Thursday like, "Hey, you're going to run club?" Yeah. So this is like my chance to have a schedule, and I have now like external accountability for socializing, which independent of exercise, socializing has a lot of value in helping with depressive symptoms.
Yeah. Yeah.
Finally, you brought up like self-efficacy as a huge portion of this. So I talked at the beginning about your sense of value being one thing that's lost. And it's really easy to kind of build it up, not even in the context of your body image, but just like, hey, I could do this hard thing. I can accomplish this challenge.
Right. Well, and the overlay of that, I think one of the things interesting, and there's this, we'll put in the show notes, but like there is this one training that's like trauma-informed weightlifting that they've been doing studies on. I think it's in the Massachusetts area where they've been doing the research on this. But basically, I mentioned that because the other thing I was going to say, that this is true for anxiety, maybe even more than depression, but the idea of physiologic distress tolerance and kind of an exposure therapy sort of way through exercise. So like when you go running, you might feel your heart racing, you feel sweaty, you feel all of these things that you might also feel when you're having a panic attack. But your brain, and like there's a different context, there's also a sense of building tolerance to that feeling. So going running doesn't necessarily feel like the panic attack, but it has components of it. So that the next time you're having the anxiety, there may be a part, I think that there's research emerging around whether this tolerance of this physiologic pain and distress to a certain extent that's helpful, similar to an exposure therapy. We're not just going to lock you in a room with snakes as your first session, but that this built up tolerance of that can can create a broader sense of sort of well-being or reduction of sensitivity to anxiety, which can be true in, can be true in weightlifting. It can be true. And I mean, that's also true for like the first time you go to a workout class or a run club and you're kind of like a social anxiety exposure.
Mm-hmm. Yeah, that makes sense. Like a lot of running for me has been progressively teaching myself to handle more uncomfortable feelings. And if you're exposed to a heart rate of 180 in a totally benign context, I could see how it'd be easier to handle that when you're in the throes of a panic attack or something else, or how you're like, oh, I've experienced this fast heart rate before. I know I'm not going to die.
Right.
Because I've done it when I was running the 5K. That makes sense. Wow.
Yeah. And it gives you a reason to, you're tolerating it for something that's meaningful to you, right? Which I think is one of the things I really like in acceptance and commitment therapy, or like including exposures within that, is we're not just causing you pain for the sake of pain, like to make you have a better pain tolerance. Because to me, that's kind of meaningless. I think to patients, that's kind of meaningless. But if you really think that it's like, Preston knows this, I'm not wearing rollerblades right now. Joke, that's aside. But I'm trying to learn how to rollerblade because I've never been able to. And it's scary and I have weak ankles and it's kind of painful at first, but it's so cool to me. And I've thought it's so cool for so long that if we can connect movement and exercise for people to something that they think is cool and gives them value and creativity, then that is another positive in their life in addition to exercise itself.
That's kind of how I feel about smoking cigarettes. Like,
what?
Because I have asthma, so I have to continuously increase my tolerance to them.
I also have asthma.
I've never smoked a full cigarette.
Exercise-induced asthma warriors raise up.
If I wanted to, it would be kind of with the similar tenacity and structure of someone who's learning to run a 5K. So now we can transition into eating disorders and exercise, because now we see there may be some negative aspects of exercise as they fold into these types of psychiatric illnesses. So people with body dysmorphia can use exercise almost as a means of purging or suppressing their weight.
Well, I want to even back up outside of a specific diagnosis, because I think sometimes we hear diagnosis like, I don't have that, so it doesn't apply to me.
Sure.
But I think what you and I both talked about is the pros and cons of our own relationships with exercise, and kind of go in psychiatry, we give something a name and a diagnosis when it, is enough outside of the quote unquote norm that it's disrupting function. But if we think about it as a spectrum of a positive versus a negative relationship with exercise, and recognize that there can be in between the spectrum, I think it can give us a conversation. And so what you're saying with body dysmorphia or body image, but if we think about the spectrum of healthy use versus maybe less beneficial use of exercise.
Yeah, I'd say adaptive use versus maladaptive use.
Yeah. And so one of the things you're saying is as a mode of purging, which is true definitely on this more intense
side. And I think I jumped
side.
right to the extreme.
Yeah, but that's okay. I mean, I think it helps us to walk it back too.
Yeah, and so it's actually interesting. As a med student, I worked on a project to kind of define what makes exercise unhealthy. So there's compulsive exercise, there's exercise addiction, and there's maladaptive exercise, and not a lot of them have these well-defined names. So a lot of different papers don't have any consistency between trying to assess or even measure what is unhealthy about someone's exercise.
Right.
And so they have a lot of these questionnaires that basically ask, do you feel guilty if you don't exercise? Do you feel compelled to exercise if you go multiple days without doing it? Or, and then to even the farther end of the spectrum, do you neglect relationships or other things in your life because of this need to exercise?
So kind of an adapted addiction screening or substance use screening.
They pretty much took a substance use disorder screening and then replaced alcohol with exercise.
Right.
And I think there's a lot of those that I felt have been a part of my life. I definitely feel guilty about not exercising if I go 2 days without doing it. And I think I wonder how adaptive or maladaptive that is. Because I do have a lot of positive reasons why I want to exercise. I know it's going to make me feel good. I know I'm going to sleep better. I want to get stronger, but also you gotta feel like crap if you don't, and not in a physical way, not just in a physical way, but I'm bad for not working out.
Where it's something more. And it's interesting because I think an example of this, well, not to be like, it was such a healthy exercise relationship, but I just, as you know, I just got off of like a month of fellowship interviews and being gone over the weekends and like kind of intense clinical time, just like being able to balance everything. And so exercise was like, went from being something I do on purpose, like 4 times a week, to I guess I'll like to kind of like, oh, I guess I'll walk to work today, and like no real formal workouts. And maybe I went to a workout class or went on a walk with people, but like sort of fell away from me for the last month. And like this week now I'm getting like back into it because I have time again. But you're saying something of like, maybe there's less of that flexibility, at least for you in the past, of where does, like, if you think of what your life stress cup that has you stress as in positive stress and negative stress, whatever in it, even when it's like really full for whatever reason, I think of like being on nights or being on surgery when you're a med student, even then it's hard to have the compassion to say maybe exercise doesn't look the same here, and that's okay because like my other values in life right now are more important.
Yeah. And so for me, it's always been pretty inflexible.
Really?
If you didn't go to the gym, you're a failure. Or if you didn't go for a run or something, like that's...
If you didn't smoke a cigarette.
Yeah. Like, Preston, 5K today because you weren't able to get down that pack of Camelbacks.
I'm laughing because I also smoked a total of 2 cigarettes in my life.
I don't know these brands of cigarettes. But yeah, so... And I think that's been something I've been trying to work on. It's funny, like I spent a lot of time in therapy disentangling my relationship with academia. Like if I fail this test, I'm not a failure. Like I don't become a noun. But then like me and my therapist totally skipped over all of that, all the like athletic stuff and the exercise.
You're like,
things.
Don't worry about that. That's super cool and not weird at all. Not worried at all. Not bad.
Yeah. But I will say, and when you look at the lens of maladaptive exercise, one thing that's helped me has been staying away from these rigid goals. So I think some people will identify, and as you see this a lot come up in eating disorders, is a number on the scale,
right,
as the specific goal or something that they're trying to shoot for. And that's, I refuse to weigh myself. I don't try to go in that context at all. And I think I just kind of see getting to the gym and working out hard as like my end goal. And if I've done that, I've succeeded. But
so the process over the product.
Correct. And I'm not just measuring it based on what I see on a scale in the morning.
I think you have to ask yourself if at any one time in our lives, right? Like you and I are doing this podcast right now, which means we're not doing 1,000 other things that we could be spending this hour doing. Similar with exercise, it's a great thing. There are a lot of great things in life. What are your values, and how does exercise fit into that? To like the one where the question on the adapted like substance use screening of, does it prevent you from seeing people or going to meaningful like functions, or have you gotten in fights in relationships because of it? Like, do I have to go exercise for an hour and a half when a friend really wants to talk to me on the phone and realistically I can only do one or the other? Like, okay, well, if I come down and like, obviously some of this starts with also being like, none of these define who I am. But the second part being, how do I operate in my values today? And can I go to the exercise class some other time this week or whatever? But like knowing that our time is a value sort of decision. And
to have the balanced view of yourself that I'm someone who hopes to exercise and also has times where they can't.
Right.
And I have this like black and white view of myself where I'm like, I either exercise or I'm filled.
Yeah, that's tough to navigate.
Yeah, it's really hard to just operate in between those extremes.
Yeah.
But I think it's really important. I'm being hyperbolic here. Like having self-compassion is so helpful to navigate your value system. I think some people that don't have that range of black and white can set these rules up that like I'm a failure if I don't achieve X number on the scale or lift this much or run this time.
Right. And it's also like in our culture, like if you think, and I love these movies, like I love the like, black, like all basically boxing movies. Like I love the like sports movies where it's like someone pushes themselves and you see the like montage of them like going to the gym and getting stronger and then being like superhuman
montage.
Yeah. And so it's like, and again, I don't think that on itself is like bad. it's just bad when we become blinded by it. So, but we have this fantasy in our culture. For men, it looks like a hero's journey of like getting so strong that you're like invincible. For women, it looks like becoming the perfect kind of like desirable object in some ways, or at least it has historically. And those stories like poison us in some ways. Like when we go towards exercise, it's not okay for you to just like you have to go to the gym because you're going to like lift the heaviest thing ever, rather than just like, I like hanging out with two of my buddies and like sweating makes me feel good and this is probably good for my bones. Like those aren't like ideal enough in some way in our culture.
Have you ever heard of the term orthorexia?
I sure have. Why don't you tell me about it?
So this is interesting. It's not in the DSM here in the US, but I was working with some researchers in Norway and Finland, and they said in their equivalent of the DSM, orthorexia is actually a diagnosable condition there. And so it's basically, for those who don't know, orthorexia is the obsession with healthy or perfect eating to the point of creating restrictive behaviors that cause disorder in your life. So I think in layman's terms, picture an almond mom who is so obsessed with not having any kind of processed food or unhealthy food that it actually is like confining her diet and making things unhealthy, or like other people in their lives. And the same can be for like the Silicon Valley gym bro tech boyfriend who like refuses to let a carb go into his salad, and then they like are B12 deficient, or they have like such little fat in the base of their feet that their bones are like grinding on the sidewalk.
Is that a thing that can happen? I didn't even know that one.
So in bodybuilders, when they go through cuts, they have such little fat on like the parts of their body that they said it hurts to walk on stage or like to walk barefoot, because it's just like basically their joints pressing directly against the ground. And then the other thing is that the exercise can be unhealthy when it's aesthetically driven. So people in these health spaces that look like super fit and have like 5% body fat also may be using things like anabolic steroids and creating unhealthy standards, and then are paradoxically making themselves less healthy. So it like classically you'll see someone who looks jacked out of their mind. They have 4% body fat. They can bench 415 pounds. And then they also have an ejection fraction of 35%.
Right.
Or
you see like one of these like, and I will say, I think there's been more openness about this on the like female identified side of fitness, but it's still quite bad of like, you know, your favorite workout influencer. Like if it's hard for some / maybe many women to have a 6-pack and still have their period. And if you're not menstruating for the reason of like undernutrition, then there are other things that are also happening to your body. Not the most concerning, but one that I am the most concerned with often is bone health, because bone health is hard to get back once you are outside of a certain age range where it's the most building up, which is usually before the age of 30, which when are eating disorders, or when is this more like even outside of a diagnosis, but just behavior, because you can do a whole lot. I mean, I think of like time. I mentioned the like Kim Kardashian workouts before prom or homecoming of, you know, what is normalized at like the lunch table, or, you know, Preston, you mentioned like what's normalized on the track team in college, and you just can't even see what it is unless it's extreme, and then it's that person has a disorder, but not me.
And so to clarify, if you're not getting your period, that's a sign that your HPA axis, your hypothalamic pituitary axis, is off, and then you're not producing estrogen. And estrogen is what's necessary for bone growth in these individuals.
Yeah, I think it's a little more complicated than that. We're not going to go on that. Although I do think doing a what is cortisol episode would be interesting at some point. But yeah, or there's also REDS, which is relative energy, I think, deficiency syndrome, which is present in a lot of athletes, especially female athletes. That it's like for, you know, like college girls on the track team, like they need to be eating more than the person who's not doing high intensity exercise for 2 to 3 hours a day. But there's still this kind of like normalized diet. And hopefully this is getting better. You know, I think there is many more conversations about this than there used to be. But
so in college, we had a physician who would talk with us every 3 months about this, actually.
Wow.
and he'd be like, he would bring up the female athlete triad, which I believe is osteoporosis or osteopenia, amenorrhea, and I don't know what the third one is. I guess
Yeah, I don't.
not eating enough. I wasn't I was a male athlete, so I was like, oh, the triad
You're
doesn't
like, not
apply to
me.
me.
I'm
Yeah,
good.
but I was interesting though because
Yeah,
I
not
remember
eating, you're
a
right.
lot of people resented him. A lot of the like women on the team resented him for it. And I think he kind of saw it as like, my priority is to like make sure you guys are healthy and that you don't get these stress fractures, because a lot of women got stress fractures on the team.
Yeah.
I'd say like a higher ratio than men. And I think it didn't make sense to me at the time. And it kind of, after going through medical school, seeing things like REDS and HPA axis disruption made more sense to me.
Yeah.
But the athletes almost saw him as like another barrier to them performing the way they wanted to. So it's,
Well, and there's such mixed messages. So it's like, I'm sure the coach though, because I remember even in cross country in my like Midwestern school, the like really good runners, which I was lucky to not be one, so I had no pressure. I was like, I'm doing it. I'm breaking 7 minutes. But I remember there was still this mythology that's like, the lighter weight you are, then the faster you'll run.
Correct.
And it's like, well, yeah, you're good. You're gonna be lighter weight, but you know, you're gonna be weighed down by the boot for your stress fracture that you keep getting. Like, you're not gonna make it to November if you're not eating enough for your bones to take the impact.
Yeah, and like some of the fastest girls on the team had more muscle, and it was like kind of challenging because like, and the same on the guy side too. Actually, there was these like kind of big bulkier guys, and they were able to run the 10K 28 minutes, which is like NCAA, like almost like all American level. And then there's like other dudes that their strategy was just to restrict more, because if I'm lighter, then I can run farther, and then they'd end up running worse times. So even at like the highest level, people will buy into that mythology. Talking like Division I cross country athletics, and still end up with a negative outcome.
I think we can also recognize that there's like, again, there's a lot of decisions to be made around performance, and that there may be like slight slivers of truth to some of these things and certain really specific settings, much more than the mythology makes it seem. And there's the question of like, do you want to run well for a season, or do you, like, how much of your, like, let's say that myth that was true, right? What if you could, I feel like something I would hear people thinking or talking about would be like, well, I don't care what my bones are like when I'm 45. I just want to run as fast as I can while I'm doing this now. I'll deal with it later, which I think is not an uncommon kind of view.
Or, I don't care if I die when have a heart attack when I'm 60. I want to look jacked now.
Yeah. Yeah. So that this is like this topic. We're talking about how good it is, but also that it can be or can become, especially if like, I think about in the eating disorder world that there's conversation around, what are the things that not cause, but like what correlates with an eating disorder. And one of those things is when people get like a GI illness, or they have, for some reason, or if they like have type 1 diabetes. And for whatever reason, even with sickness, they lose weight. And then people start noticing and complimenting it. And I think about this also with someone starting an exercise routine is like, where are you at with your body image? And if you're talking with your clinician, do they know that? Because if you're someone who struggled with disordered eating in the past, and maybe you were fine with exercise, but then you take on exercise and people start noticing and complimenting you, it can be a real trigger to have more of this rigidity come back on.
Yeah, it's like, it's reinforcement for the unhealthy thing.
Yeah.
Like, I'm getting social praise for having food poisoning or like a parasite.
Right. Yeah. And kind of like the social praise understandably feels so good, especially depending on, what kind of body you're in before.
I mean, who doesn't like social praise?
Just kidding.
It's true. So reasonably, someone would hope to modify their behavior to support that. So now kind of looking at mental health as being treated by exercise. Is there a best form of exercise that we can use?
Yeah, so that's there's a complicated answer, but I think the answer is freeing in that it is complicated, which is that there's a lot of different types of exercise that can help your mental health. One of the best studied or most frequently studied has been aerobic, but there are now studies around like weightlifting, resistance training, and like forms like yoga or Pilates and mindfulness, which is one part we didn't mention, is that like mindfulness as an intervention in itself helps with depression and anxiety, done correctly. and that there can be a component of that in exercise forms as well. In terms of,
I was going to say, and then I think cardio led the pack, pun intended, because it's really easy to measure both.
Right. And it requires
logistically
less, like sort of less facilities, right? Like if you want someone to like deadlift a 200 pounds or 300 pounds, whatever, like that requires things. Whereas if the study is 30-minute walk outside each day.
Correct.
Yeah. The part about how much and then the question of intensity, I think is also an interesting question. So all of this is to say is to moving a little bit more, if you're not moving very much, in a way you enjoy and in a way that you can slowly build up, and it doesn't interrupt these other positive aspects of your life that impact your mental health, is probably going to help out. Concretely, I think that there's some reason I think there's different studies on different interventions, and then you ask about effect size. So maximizing somewhere between probably like 90 minutes a week to 150 minutes a week on like the cardio studies, which is also
it's the American Health Association guideline.
Yeah, for heart health, which I think that one's more informed by heart health. But like I think in this case, that can also be good. But that sounds like a lot, right?
So what is that, 150 minutes? What does that come out to? About an hour, 3 times a week?
2.5 hours, right?
Yeah. So 2.5 hours. So if I work out an hour Monday, an hour Wednesday, an hour Friday.
Right.
That's
or
moderate.
If you walk for 20 minutes after dinner while you call your parent or while you are with your kid or what have you, or your pet. That also counts.
How do you define moderate intensity exercise? I think it has to do with whatever
heart rate. Rate of perceived exertion.
Yeah.
RPE.
Yeah, exactly. And so I think it has to do with your heart rate reserve as well. So I think it's like if you get into level 3.
Yeah. I mean, I think the way that a lot of places talk about this, the zones of heart rate, is the like kind of talking and breath test during it. So like
exactly.
Walking slowly where you're like, I can talk no problem, is like light or sort of like zone 1.
And moderate is like barely can have a full sentence.
It's like I can talk to you, but I'm going to be kind of puffy. Like I'm going to be like, yeah, that was a really great point you made, Preston. And I didn't like that.
Okay, I can feel that. So I guess the reason why I'm getting granular about this is like, let's break down like what it would actually look like to meet this AHA goal.
Do you try to meet this goal in your life?
I guess I exceed it. So the other option is 75 minutes of vigorous exercise, which that's the point where you can't really talk, I guess.
Yeah.
So I have a soccer game every Wednesday night for about an hour and a half or an hour. So it's about 60 minutes of vigorous exercise. And then I go to run club on Saturday morning, which is about 45 minutes to an hour of moderate to vigorous exercise.
So you already met the 75 minutes.
And then I might lift another day or so in the week. Another day or two, which I try to make it moderate, but then you get in the bench press and you just think about how much you hate yourself, like, and then it becomes vigorous exercise. Yeah. So I think that's like realistic for me. But even let's say you couldn't do it, you didn't have a soccer game or run club. Like, how could you accomplish this?
Like if I was, let's say, okay, so those are kind of I will say, I think like overall health wise, outside of mental health, the ideal is sort of that you're lifting heavy things a few times a week with some regularity to build up muscle to help bone strength. And also there's some kind of interesting research around cytokines and neurohormonal regulation via BDNF through resistance training as well. So I think that is in line with mental health too. So let's say a couple times a week, working most muscle groups in a way that is to failure. And then heart rate, getting some like 150 minutes is like the ideal, but let's say 150 minutes, most of that is kind of this sort of moderate, like walking, dancing, biking. Like it's a little tough, but you're not like gassed during it. Then maybe a couple like spurts of higher intensity for like 20 minutes of that a week. So that's sort of the ideal. But I think one of the things you were getting at, Preston, is how do we start this conversation with a patient? Or like, what if they were interested in this? They're like, you know what, I used to play soccer when I was a kid and I liked movement. I like this, and this. Like, I'm curious how you would go about starting. Let's say you're an outpatient and you're like, I'm going to see you in a month. We'll see how that increase on the Zoloft went. And I'm going to ask you, this is something I often do, is I keep this in my like lifestyle factors part of my note. And I'll say this, and this. Like I'll have like not substance use disorder, but like substance connection, hobbies, meaning making, exercise, sleep, things like that. And so if I say exercise, I'll be like, okay, I'll ask about it in a month. But I'm wondering what that would look like for you.
Yeah, it's
How you would
funny you
ask
should say that
questions.
because I have my therapy panel. I'll go through exercise with my patients, and I often use sleep as the first way of kind of like bringing up exercise
Yes.
because sleep hygiene is really hard to pin
Yes.
down for people. But one thing that you know is if you work out hard during the day, you're going to sleep so much better.
Right.
And it was funny because like I knew that like didactically, but the time I think it was really hit home this last year when I'm trying to think about how to help my patients with sleep. And then I went on a 20-mile hike in Mammoth, and we were backpacking, and it was like terrible ground, is cold. I'm sleeping on the rocks, and I slept so freaking well. I was like, oh my God.
Like, is this what being well feels
I hiked all day, and I was just freaking out. And like my friend Trevor was with me, and his watch was recording him sleep. He was like, yeah, it said like I hit like deep sleep, highest quality within 30 minutes. And so I think the whole time I was walking back down, I was like, honestly, exercise, it really helps with sleep.
Yeah.
And so it's funny because that went from being, I guess, an Anki card in the back of my head to now something when I ask people how their sleep is, they're like, oh, it's, it's kind of, it sucks in this way. I have trouble falling asleep, or I'm antsy. I use that to say, well, how do you exercise? And then and then I kind of almost relate exercise as a means of helping with their sleep at night. Cause I think just about everyone can get behind sleep.
Right.
Wanting to sleep better. And I think it's so much better to do that than approaching it through someone's body image.
Right.
Because
totally. I really hope people are approaching it. How do you feel like you're ugly? I have a solution for you that might help your depression. That would be crazy.
This is it's the classic like 1980s like cardiologist approach, which is like you're gonna have a heart attack if you don't freaking exercise.
Right, the shame into people to exercise.
And then they're like, the patient's not exercising, and they go back to their attending like, did you try shaming them harder? Tell them about how they won't be at their daughter's wedding if they don't exercise.
Try scaring them more. Also, your cats are fighting in the background for anyone watching the video.
They're playing. They were playing chase earlier.
One of them just hit the other one.
They're getting their moderate exercise for the week.
They are getting their movement in for the day.
So I try not to shame them, and then I use sleep, and then the next most important thing I'd say is SMART goals.
We love a SMART goal in this house.
Because the amount of times like I'll be in a primary care setting when I'm like rotating with family med or something, and someone wants their goal to be like, I just want to exercise more, and I'm like,
what does that mean?
And I want to look better. Yeah, exactly. Like, and I want to write more.
Right.
Neither of us are gonna accomplish that. But if you sit down and say like, okay, what does exercising more look like? And I make a small goal of 20 minutes a day on the treadmill, Monday, Wednesday, Friday, and then I'll try to get really granular with them. I'll say like, what are we gonna set the angle of the treadmill at? What speed is it gonna be set at? Yeah. So one thing I've adopted sometimes is like the 12-3-30. Have you heard of this?
Yeah, but that's like a really hard one if you're having people do it. It's hard.
It is hard. Yeah, I do it myself.
Hot girl walks mentioned. Heard.
So I'll do like a modification of that. I'll be like, okay, set it to an angle of 6, 1.5 miles an hour, 2 miles an hour, and do it for 20 minutes. And I'll be like, watch an episode of The Office or something. And then they're like, oh, I can do that. And then like, I think the more details you give to someone, the less uncertainty they have about accomplishing it. Or even like telling someone to join a soccer league or something can be like one of our therapy goals if they're looking at finding that community. So that's kind of how I approach exercise, I guess.
No, I think that's awesome. I think I approach super similarly. I think also like, taking out as much barrier as you can, especially if you're someone having this, like there's benefit. And I think also from us sharing our backgrounds, we have very different backgrounds, but both of us have a lot of experience of being in movement or exercise or sport communities, and therefore having like kind of an easier on-ramp onto exercise. Like it's so hard if you're someone who's never been to the gym before. Like it was like, and so much of that is also in your childhood, not just
it's an intimidating place, the gym.
Right. But even like going to a soccer league or going to a run club or like trying these things out. And as we talked about with like the internal narrative around these things, it can be really hard if you're like, I'm someone who's not an athlete, I've never done this, and it's too late and I look embarrassing and everyone's looking at me. So also, again, making it the right size exposure is something I think a lot about in my therapy cases, and I think about with exercise too. So if someone's never been to the gym, but if they sort of like dancing, then like, or if they sort of like stretching, then maybe I'll tell them to try a Pilates like YouTube video, or I'll be like, have you heard of the fitness Marshall, who is been my favorite dance like exercise instructor for forever and is like millions and millions of videos or views or whatever on YouTube. But making things as straightforward as possible and then kind of measurable, like you're saying. And then I also will step people back because I feel like people normally say something to me like, oh, I can do this, this, and this. And I'm like, that sounds like a lot. Like, what if we made it so you felt like you were 100% sure this would happen before I see you next? And what does that amount look like?
Yeah, going to salsa dancing on Tuesday night. That's it.
Which would be awesome, I think.
Yeah. That's the only goal. Rather than I'm going to go to salsa, I'm going to go to Pilates, I'm going to lift, I'm going to start changing my diet as well.
Right.
I think I found like with those types of goals, the lofty goals, the second you start to realize that you're not going to complete it, you just give up altogether.
Right. And that like recognizing that thinking about movement in a different way, similar to thinking about anything in a different way, takes a lot of kind of reps or walks down a new neural pathway. Right? If we've always thought one thing about movement, or if we've gone to the gym 100 times, like while berating ourselves and being like, pain means you need to push harder, it's going to take some time, some reps behaviorally and psychologically for that to feel different too. But just because it doesn't change quickly doesn't mean it doesn't change.
Yeah. And I think that's something that I say to my patients too. I'm like, if you like work out today, what's going to be different tomorrow? And they're like, probably nothing. I'm like, you're right. Probably nothing.
Probably nothing. Yeah.
But you keep doing it and it becomes a part of you, then it changes. And I think there's that saying, like the man who loves walking is going to walk farther than the man who loves the destination.
Yeah.
And so we're really just trying to get people to like walking. And then, and with that goal setting, I guess I like to add, I'm really against any kind of goal setting around weight. So if
I don't think even health behavior that is even indicative for like,
please throw the scale away. Because it doesn't even make sense. Like I'll ask like, so your goal is to weigh 100 pounds? I'm like, yes. And I was like, why? And they're like, so I look a certain way. I was like, so is your goal to weigh 100 pounds or is it to look a certain way?
Right.
Oh, and the problem with making a goal numerical like that is as you approach that number of 100, you're like, well, now what? Oh, let me lower the goal to 90.
Right.
Let me lower it to 80. Let me lower it to 70. And so it's not scalable. Like I can't continue to build off of this goal if it's something around weighing less. Whereas if my goal is to have fun while I am consistent about attending dance classes, you can scale that and you can add other things onto it without it kind of turning.
Then the question becomes not how do I like restrict more, exercise more, and get down to this size or even this aesthetic. And listen, I'm not totally against aesthetic goals. Like I don't think it's like bad for people to have them. I just more am opening the conversation. I don't think you do either. But
yeah.
But then the orienting question becomes less of how do I get my weight further down on the scale, and it becomes like how do I have more fun doing this, or how do I become a better dancer? How do I get stronger? How do I get to do that move I saw someone do at CrossFit or something that I thought was really cool and looked like a superhero? Like, and those questions. Sorry, the cats are fighting. The girls are fighting again. They're good. Okay. But the values-based question, and that's why I think it's so individual with patients of asking. I always ask them like, before you knew about changing your body with exercise or weight or whatever, or like performing, what kind of play did you like to do? Like, I like playing this game, Big Bopper, which is like a easier version of wiffle ball that me and my siblings used to play in the backyard. Like, okay. And like, that's like a simple one. I'm not playing wiffle ball now here in Boston, but like asking people like, where was joy and delight? And then building from that rather, because then the pain is on the way to delight. Yeah. It's not pain in and of itself or control.
Chasing delight rather than running from shame.
Yeah. And that like meaningful delight might mean like, okay, if someone wants to run like a marathon, they still might kind of hate their long runs. They still might hate like there might be some pain obviously involved in that. But if it's valuable to them because they're like, I just think it means something really cool and it would mean something about me if I could do this. And can I do it in a self-compassionate way, but help me grow and push myself in a positive way? Then like that is a good goal for them. But it might not be for someone who wants to like, be able to climb up the side of a cliff or something. Clearly I don't climb because I don't know any of the verbiage. But finding the value with patients of like, you mentioned you like this and you used to like this, or you think this is really cool. Like you go to Broadway all the time and love the dances.
or you mentioned you like the documentary Free Solo and you wanted to climb El Capitan.
Right.
So let's get behind that.
Right.
But not
And
fall off.
I think one of the coolest parts of being a therapist or a psychiatrist, if we can have like even just a minute or two for it, is being able to like co-imagine with our patients, like what does a full life look like for them? And I think this is true with exercise too.
Just exercise as a component of a full life. I think it's silly that it always comes down to goal setting almost. And then when you have this really surgical discussion about goal setting, it turns into like, well, what is the meaning of life?
Yeah, always.
So fast. It always happens because it's like, well, I want to be fit. Well, why do you want to be fit? So I can spend more time with your family. Why do I want to spend more time with your family? Because the meaning of life is having having like compassionate interactions with my family. Like, you know what I mean?
Because they annoy me, but I love them.
Yeah, exactly. So it's funny how quickly it comes down to that so fast if you ask a couple pointed questions.
Yeah. Well, I think the last thing that I'd like us to end on is we started with what's our background with exercise, but I think like what you just talked about, like what is you think the most meaningful reason you have for exercise? And you can't cop out and be like, I want to be around for my family because like, yeah, all of us want that. But like, what is the thing that you feel like is the most positive or delightful part of why you work out or your current kind of workout schedule? I can start with mine.
No,
so
I'm thinking. Actually, you go first, please.
I have never been able to do a full push-up in my life, and I'm slowly inching closer to that. And that is a delight to me because it just, I don't know, I'm so proud of myself that I'm getting closer to it. And it's because I've been doing more strength training. It doesn't look in any way good. And this is like not a goal for anyone else, but the fact that it says something to me and is meaningful to me of like, wow, I never thought I'd do a full push-up, but I'm going to be able to, I think, soon. So that to me, that kind of feeling of strength and empowerment and function is delightful. And I think it just seems cool to me, for lack of a better word.
I mean, it is cool. Push-ups are badass. I would say for me, it's reclaiming a sense of joy. So I had my like first rec adult soccer game last week, and my shoe fell apart. I hadn't worn these shoes since like high school when I played competitively. So the whole bottom plate came off, and I went onto the sideline. I like wrapped it in tape, and I like MacGyver this thing, came back on, and it was weird, like sitting in this moment while I'm like wrapping my shoe in tape, going like, I'm gonna get back on the field. I was just having fun.
Yeah.
I was like, wow, I'm exercising and I'm having a good time. And like, we lost so bad and I didn't care because I was just I was like being with people and enjoying the moment. And I think for so long, soccer or track or lifting, whatever, it was just so much pressure around it. Like if I don't lift this, I'm going to look a certain way. If I don't achieve this time, I'm going to suck. I need to perform well. My coach is going to cut me. And I was like, holy crap, I'm just having fun.
Yeah.
You know, like we just got scored on so bad. I'm like watching my teammates get frustrated. They're like, the goalkeeper's a liability. And I'm like, I think he's having a good time.
I think we're having fun, guys.
Yeah. So like taking the pressure off of myself and just kicking the ball and running up and down the field and having a good time was liberating.
Yeah.
So I think that's probably what does it the most for me. Because as a kid, when you pose that question, what did you do for play? For me, it was always running around outside.
Yeah. It was jumping off that tree or the trampoline.
Yeah. Yeah. And I lost that somewhere. The plot was lost somewhere along the story of me taking my talents as an athlete and marketing them.
Right.
And now that they're no longer a part of my economic output, I guess I can have fun with it. So
yeah, they're just
that's
there
what it does for me.
The sake itself. There's this the book The Wisdom of Your Body, which is by Dr. Hilary McBride, is a book about kind of embodiment. But the metaphor she uses that is used in like objectification and feminist theory, but I think is applicable for everyone, is this idea of when you're a kid, like it's this metaphor of the house, which is when you're a kid, you just live in the house. You know that the kitchen has food for you. You like have a nice soft bed to rest in. It keeps you warm in the winter and covered in the rain. And as you get older, you see that other people are making comments about their houses, about how like the roof is kind of bent funky and the paint is peeling and it looks this way from the street and da 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 da. And then they tell you can make improvements on it. And eventually it gets to the point where you're no longer living in the house, you're just sitting in your front yard looking at it. And so to me, I think it's such a powerful metaphor for everyone of just the bringing people back inside into the house for all the beauties that it is to have a house or to have a body that moves you around and lets you play and lets you belly laugh and allows like love and intimacy and playing soccer, right? Or singing or whatever, all of these things.
Because no matter how compulsively and meticulously you try to keep it from being damaged,
it's going to get damaged.
It's going to get damaged regardless. Like, wear the pair of sneakers, that's what your body is.
And we're at the existential again of like, we are all going to die. So we might as well get kind of.
Yeah. And you have a means of experiencing fun, like your body.
Yeah.
Do it, bro.
Let's
just
do it. Let's be like the cats, just fighting each other. They're not. They're resting. They're chilling.
Okay, good. Yesterday, Lilac was just charging Maggie, and Maggie's developed this new move. She just jumps. She gets like 3 seconds of airtime, and just Lilac just drills straight under her. It's pretty.
She's developing new learning and competency through exercise.
I think Maggie actually has been more pleasant. Like, her affect has shown some improvement having Lilac in the household. I think a big part of it is just the exercise and behavioral activation of having
a sibling. I don't know,
crazy like half tortie, half tabby little sister who's running
They're
around.
Such good little pals.
Yeah, they foil each other well. So it's been actually nice to see just the sheer activity.
The joy of movement in the cats.
Yeah. By Dr. McBride. Okay, so yeah, I think this was a good conversation to start for a lot of people how exercise is a fun topic and how much it folds into mental health.
Well,
I think one thing that
both of us. Oh, sorry. I was like, clearly both of us enjoy this topic. So if there are questions or there are comments or things that you feel like we got wrong, like let us know in the comments, like send us messages. But like we are happy to come back, I think, to this topic in more depth because both of us kind of nerd out on it and like it. Yeah.
And like all my pride is in being correct and not approaching the truth. So if
that's on next week's episode.
Yeah. So if you confront me, I'm just going to tell you that you were probably wrong, and I'm going to question the viability of your study if it disagrees with me in any way. Because the truth doesn't matter at all. We don't care about that. We care about our pride and being correct.
Cigarettes, despite what our doctors around our asthma say.
I'm just kidding. I care way more about being right. So like, please correct us, and we'll make sure it's the proper information for everyone. And this is a good segue into our next episode, hopefully, which is going to be on motivational interviewing and attacking ambivalence and people that have a gap between what their desires are and what their actions are. And very commonly, it's, I wish I exercised more, but I don't.
Right.
And so there are like methods you can use within therapy to help people kind of move past those barriers.
Yes. And we'll have a guest.
Yeah. Our first guest. Our guest, our
Maybe.
Third guest.
Our third guest here.
After Maggie and Lilac. So thank you guys so much for listening. Please let us know how the show was. Like we said, any feedback is always welcome. You can find us on our socials at Human Content Pods, or you can contact the team at howtobepatientpod.com. Please shout out to all of the listeners that left us kind feedback, and we'll be reading some of that off soon. And let us know if you have anything fun coming up in your life. If you have a recent graduation or a match coming up or something you want to celebrate, we want to celebrate that with you.
Or exercise that you think is underrated.
Or an exercise.
And Preston and I are going to be forced to try. I'm going to get Preston to try a reformer Pilates class at some point.
I have done Pilates once. I didn't
Reformer?
enjoy that. No, not performer.
Reformer.
Reformer. Okay, so I can spot correct my fat. If you want to find full episodes, they'll be on my YouTube channel at It's Presro. And sometimes I'll post them on my TikTok, but like just the sound bites and stuff on my TikTok. You know, the things that they generate clicks and revenue, and the things that matter the most in the world.
And you can find me at my TikTok, which is Bad Art Every Day, where I don't talk about that much about mental health, but I do talk actually quite a bit about avoidance and exercise. So that's true.
Anyways,
I do.
Thank you for listening. We're your hosts, Preston Roche and Margaret Duncan. Please connect with us at howtobepatientpod.com. Our executive producers are me, Preston Roche, Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brooke. Our editor and engineer is Tracy Barnett, and our music is by Omer Ben-Zvi. Please check out our show notes and see the references and resources that we discussed at the end of this episode, because we did go over a lot of facts this episode that we will make sure we got right, or mostly right. And to learn about our program disclaimer and ethics policy, submission verification and licensing terms, and our HIPAA release terms, go to the website, howtobepatientpod.com, or reach out to howtobepatient@human-content.com with any questions or concerns. How to Be Patient is a human content production. I'm Preston Roche. That's Magnolia Smalls. Lilac doesn't have a last name. And this is Margaret.
I'm Margaret.
Thank you.
Bye.
Bye. Thank you for watching. If you want to see more of us, or if you want to see, this is Lilac, she's my cat. She's going to be waving her hand at one of the floating boxes, which will lead to more episodes. Lilac, point to the other episodes. Lilac doesn't know what the internet is, but I swear they're there. They probably exist for real. But in the meantime, I'm just going to pet Lilac, and then I'm going to go dance in the background.